Now, if you're looking for something a little bit different to listen to, check out this new podcast. My mate Kris Edwards is talking about living with cerebral palsy. He's the actual goat. He really is. This man doesn't want to complain about his disability, but he does want New Zealanders to understand a little bit of what it's like. So check it out.
This is the Cerebral Palsy Podcast.
Hello, I'm Kris Edwards and I'm excited to have you listening to the Cerebral Palsy Podcast. This is part of a series that explores the inspiring stories, challenges and triumphs of the people and families in New Zealand who are living with cerebral palsy. We did this podcast to support and give this community a voice because there are so many great people doing great things to talk about. Each episode will bring you honest and sometimes confronting conversations with individuals who navigate life with CP. And that includes me, by the way. On the gross motor function scale, I'm a 2, classified as the diplegia type of CP. And I put this together with producer Nathan, who has a daughter with cerebral palsy. So please rate and subscribe to this podcast so we can do more of them. Give us your feedback on any of our social platforms or chuck us an email at cerebralpalsypodcast@gmail.com. Now on today's episode, parents, you're going to want to hear this one. I chat with Tracy Winstone, a mum who talks about raising her daughter Pippa, who's got CP.
Pippa was born perfectly healthy. However, very quickly we realised that, and it could be related to the cerebral palsy, we've never actually been able to nail this down, the chain of events, but at some point we found out that her airways were very narrow and she was effectively being starved of oxygen.
And one of the things that kept coming through in this series is how cerebral palsy affects each person in totally different ways. Now here's Tracy talking about Pippa.
Because one of the things with Pippa's cerebral palsy is it affects her nerves. And that's something that we were not expecting and did not know to look for. You may have noticed her hair's not brushed today, and she's got this beautiful, big, thick, curly...
As a guy, I didn't notice.
You didn't notice? Okay, well, it's in a ponytail. She has a bunch of nerves on the back of her head and a bunch of nerves in her stomach that flare. She drew a picture for her specialist of what that looked like, and it was a lightning bolt.
Tracy also told me about how other parents' comments are just tough to deal with. Plus, we talked about the subject of guilt as a parent. Was it my fault? We discussed it in detail. Tracy is an amazing mum and Pippa is an awesome kid. Their story is inspiring. Please have a listen to today's episode on the Cerebral Palsy Podcast.
So can I ask, as far as Pippa's concerned, what type of CP does she have?
So Pippa's got left-sided hemiplegia.
Okay.
And so we knew very quickly that there was something there, and we only found out about the actual official diagnosis when she was about just after she was 4 years old.
Wow, I read that. I couldn't believe the late diagnosis for that.
There's some really good reasons why.
Yep.
Pippa was born perfectly healthy. However, very quickly we realised that, and it could be related to the cerebral palsy, we've never actually been able to nail this down, the chain of events, but at some point we found out that her airways were very narrow and she was effectively being starved of oxygen. So chicken and the egg, which came first, was at her floppy airways and swallowing difficulties that caused the reflux and the aspiration and the potential brain injury, or was she born with it and that exasperated those elements. And so her paediatrician, who's fantastic at Starship, and I always kind of said, well, let's deal with the acute stuff first. Let's keep her alive. And I know that sounds dramatic, but effectively in some ways we were.
Right.
And we deal with it. We sort of pushed that can down the road. We kicked that can down the road until we needed to know. But in the meantime, the other experts were also saying, and to be fair, our specialist, our paediatrician was also saying, well, she's just too good to have cerebral palsy. She's too mobile. She's too this. She's too that. And we were like, well, okay, fine. We don't know anything any different.
So when you got that diagnosis, when you actually got told, can you remember how you felt?
Yeah,
at
absolutely.
The time?
Relief. I felt validated.
Really?
I was like, I knew. And I wasn't, it's hard to, this is the tricky thing. I think when you get a diagnosis that's effectively life-altering or is deemed to be by someone who doesn't really know or understand anything about it, like we weren't educated and had no idea about cerebral palsy really, you expect this doom to come over you. You kind of, in my head I was like, oh, I'm going to be traumatized if this happens. I'm going to have a really negative outlook on the future. And actually I remember just being like, oh, phew, oh, I can deal with this. Now I know.
Yeah.
Now I know. We can start to do some research. We can start to understand, is there an impact on life expectancy? What about implications for even, for me, I'm a problem solver. And so giving me the piece of the puzzle I needed to understand the why this is happening, I was able to then start problem solving.
Yeah, right. And to your knowledge, and I wouldn't have a clue about the diagnosis and timeframes and all that sort of stuff. Is 4 years, does that happen sometimes, or just hard to say really, I suppose?
I think in hindsight, I could have done with that diagnosis 2 or 3 years earlier.
Yeah, right.
I think when you're being told, oh, no, it can't be that by an expert, what else do you do but listen, right?
Yeah, right, of course.
And then we could have put some more steps in place. We could have done more. And there's always the element of, I wish I'd known, because then I could have got physio more involved. The things that opened up to us, the rehab, the specialists, the supports that opened up to us with the diagnosis, like the CP Society, has just been life-altering for us in such a positive way.
Right.
Being part of a community, that made everything easier.
So I was almost 3 months premature myself. So I was 2 pound. And I was born in 1968, so that was before Woodstock. So you can imagine the facilities they had for cerebral palsy. I think I was in an incubator for a long time, like a tiny, I think it was translucent. Mum said that you could put me in your hand.
A little micro-prem.
Yeah, micro little thing. So probably lucky to live.
Yeah.
And I think she went into hospital with a sore back and came out with a baby. And they just said, you're going to have your baby today.
That must have been. I can just begin to, because your cerebral palsy is lower limbs,
so this
right?
is the diplegia type.
Yeah.
So legs only, generally speaking. So
is it a common cerebral palsy?
I think so.
Yeah. Because I know we've now got this amazing community of fellow cerebral palsy alumni.
Yep.
And particularly for Pippa, it's really important. She's got her best friend has also got I think she's got right-sided hemiplegia.
Right.
And so all of the people I know, all of the children I know tend to have a left or a right-sided hemiplegia.
Wow. I see. I didn't even know that even existed as a type of cerebral palsy.
Oh.
Yeah. Because, I just met Pippa, and it to the naked eye, you can't even really notice it.
She's exceptional,
But I do know that underneath that, just looking at Pippa, especially mixing with her sisters, she just was like any normal kid.
Pippa, and I think that's part of the problem in a lot of the cases of the mild cerebral palsy, and I think we'll probably chat about that later, but one of the biggest challenges for us is people's perception of what she can do.
Right.
And that over-expectation. And my job as a mother, unfortunately, and this is probably the hardest part for me, is going, okay, well, we've got this fatigue management plan, we've got all these supports in place to stop her from just exhausting herself, because there's some really big complications that come from that, and it all goes horribly wrong very quickly. So it's really hard to tie that up against, as a mother, you want your children to succeed and to be to push themselves and to challenge themselves and to do all these amazing things physically, use their brain, do everything. But you also don't want to push her off the cliff, metaphorically, of like that exhaustion. So I'm having to helicopter parent, but not helicopter parent.
Yeah. Can I ask you a question? One that I probably haven't ever asked my mum and dad, because I know in a weird kind of a way, I don't know whether they feel bad about it. I think it would make them uncomfortable if I talked about it with them, if I asked them whether they ever thought it might have been their fault. It's a weird...
that's a great question, because fault's really tricky. It's something I've definitely had to work through, the what-ifs. Especially when we started to investigate the how it happened. And one of the scans, I remember, it came back and it said inconclusive. So this was, I think it was a CT scan or something that we'd done. And it was not long after she'd been quite unwell with a respiratory infection. We now know that respiratory infection was effectively causing her quite significant oxygen deprivation. And she had a monitor on, and she was a tiny baby, and she had an apnea monitor on, and it kept alarming, and it kept saying not taking enough breaths or something like that. And I was thinking, oh, this stupid thing is faulty. And I thought, oh, she's fine. Stupid thing is faulty. She seems fine. I didn't know what I was looking for. I didn't know that blue skin, not blue skin, but, that she was effectively gasping for air. And my brain keeps telling me, could it have been that? Could that have been the night that it happened? But then you really just have to work through it. And you just have to sort of go, well, if it did, it did. And we know better now.
Yeah. I mean, do you know how I kind of look at it these days in terms of the body and the way it works? It's such a complex thing. There are so many little things that happen to people that cause little things.
Absolutely.
They're called different names, but it's just such a complex thing. No wonder if one little thing is off that it actually has a chain reaction. And I guess you just have to accept that that's just the way it is with this particular person, with your life, and you just make the most of it. And I don't know if it's anyone's fault really. But
you're making me emotional because I get it.
I totally get it. And I get it for them.
Yeah.
But they know that Anna's Pippa she'll be a massively independent, functioning adult, as most people with cerebral palsy are.
Absolutely.
The only thing I think, this is just guessing here, that when intellectual disabilities cross over, I think that's trickier because they have trying to cope with things on an intellectual level, that's more difficult.
Yeah.
Whereas I think somebody just with a physical disability who thinks fine, who can mature and grow into themselves as a person, they'll be fine.
I 100% agree with you. And I think this is the hardest part about being, for me, one of the hardest parts of being a parent to a child with a disability or with something either neurological going on or anything is that comparison is the thief of joy. It's that I don't want to ever compare myself to other parents and go, oh, at least my child doesn't have this or at least my child doesn't have that, because I know that the same would be happening. Oh, gosh, my child. And I've had parents say to me, with all the good intentions, children, a lot of parents think that it's perfectly okay to say, oh, I'm just so pleased my child doesn't have what your child has. And I'm like, okay, how do you take that?
Man, I would never say that.
You'd be surprised the number of people that think that it's, I could never be as strong as you. Or I could never do what you do. I could never give up my career to support a child with it. I was like, well, but you would if you needed to. It's not, but I think that's part of that education aspect. That's part of why we do what we do and come on these and have a podcast and have a conversation about it, is because if you don't know, you don't realise the impact you have.
Well, looking into the future for you, I can tell you now, as a living adult with more severe cerebral palsy than your daughter has, she will be totally fine. Because she just needs to know that you're there, like all kids. I mean, I have an almost 12-year-old. He just needs to know mum and dad is there, and he does, and he is fine. Everything else, we support him, but he will find his way. Yeah. Right now, we're going through friend groups. We haven't had any breakups, or he hasn't any of that kind of stuff. But he will be fine. So just the same with her. I mean, my opinion on kids and the way that they get brought up with disabilities, if they're not treated harshly or they're not mollycoddled, they just find the way, because it's sports and all that sort of stuff. They just get, if you want to be included, the schools and their friends will just include them, and they will just find their way, and without too many huge highs and huge lows.
You raise a really good point. And sorry, I was just going to say, one of the biggest struggles we've got at school at the moment is that at 7, sort of turning into 8 years old, these children are getting faster and stronger and fitter and more active, and Pippa obviously isn't. And while she presents perfectly, I mean, her limp is barely noticeable, her hand movements, she seems fine until she's obviously not. And then, and at school she actually utilises her wheelchair because in order to keep up with a full day of school. So she doesn't go to school full time. We tried and it didn't work so well. It just exhausted her. So
I had a trike at school. I was allowed to bring my trike.
Oh my goodness. Oh, don't tell her that. She'll want one. She's got one, but she'll want one at school. But no, she utilises her wheelchair, and she's a demon on this wheelchair. My goodness. But what I was going to say is a lot of her friends are very active, and so they go off, and she's struggling a little with that at the moment. And I'm the mean mum who says, we'll find other ways to engage. Yeah. Like if you can't run after them and climb to the top of the playground, don't. Find another way to engage with them, or find someone who will engage at you with. So she joined the Lego club.
Yeah.
which I think is amazing because I love Lego.
Yeah.
And the other thing that I've always said, and we sort of joke, I am the mean mum, and that's where I say it's that balance of being the helicopter mum, knowing that there is a limit, and trying to just pull her back from the edge a little bit and actually making sure she is involved. Yeah. And so we joined the running club because she wanted to join the run club.
Wow, amazing.
The run club looks a little different for us than it does for the rest of the kids. We run about 500 metres, and I use air quotes for that one. We get there and then we walk very slowly and very gently back while the rest of the children finish the loop.
But she still completed it, right?
Oh,
which is what you need. Any kid needs to complete things.
Absolutely.
Yeah. No,
there's no slacking off. So
that's a kid thing, not a cerebral palsy thing. They just need to finish.
Yeah.
So, but she needs to finish all the other things in life too.
And it's committing, and that's the thing, right? It's also, you say you want to do something, you make a commitment, you do it, and unless you're ill, and that does happen.
Yeah.
And it's just working through the different nuances of that. So with Pippa, she's learning to say, "Oh, but it's my stomach. Oh, my legs are cramping. And you have to work out
kids always, which is true, which is not. Yeah, kids always try that.
Oh, it's universal.
Yeah,
right?
that's totally normal. Look, you're totally doing all the right things, and she's not sobbing in the corner. So that's tricky when they just feel like totally excluded.
Yes.
But I think all kids have to find their way.
Yeah.
It'll be fun. By the time she's a teenager and she's got her friend group and they all, you'll find in groups of kids, they're very supportive of other kids.
Yeah.
It's the little individual things that get snippy. But I find if someone does something as a group, they will cheer you on.
I love hearing that because I think that's, you're right.
Look, she's going to be fine. I think the issue is, because I never really asked my parents, I don't know why, when I was her age, how did you cope? I just think they got on with their lives. It's different then, the 70s, you just did your own thing and kids went outside to play. TV didn't get turned on during the day because there's nothing on, but there's no Netflix. But I think it was just a different era and you just had to be a kid that was active. I do know my brother used to give me fireman's lifts all the time to get me over the fences and just to hurry up.
I can just imagine that. I love that.
Yeah. But I think the other thing as a parent with a kid with that has doctor appointments and therapist this and specialty that is all the waiting and all the hospitals and all the areas where people go that normally there's something wrong with them. So I think I don't love hospitals because I had quite a few operations as a kid. So by the way, have you had any operations?
Yes, so that's a really good and you raise a really good point because normal for Pippa is not normal for her sisters.
And it's boring.
And so we're struggling a little with this whole concept of Pippa has more mummy time than everybody else and more quality time and more this. And Pippa's sitting there going, but I'm being jabbed with a needle or I'm, somebody's sort of like making me run around in circles or do this or that or star jumps or whatever it is that we're trying at the time. It's not quality time to her. It's not like we get to go to a movie and hold hands and watch a favourite show or something. And so there's that imbalance. Hospitals, we've worked really hard. Yes, there is definitely trauma. There's definitely trauma from needles being stuck in arms, and so that's a big one for us that we work through. Lots of tests. We've had surgeries. She's had surgeries since she was born, not necessarily on her legs or her limbs, but she's had surgery because of her floppy airways, which is a bit of a classic one apparently with cerebral palsy.
What do they do about that?
So
I've never heard of that either. Floppy airwaves.
Okay, so I'm using the
common layman's term. Thank you.
There is different types, as we've discovered. I'm going to get this, excuse my pronunciation, there's bronchomalacia, laryngomalacia and tracheomalacia.
I think you did pretty good.
So the malatias are effectively floppy airways, but different parts of the airways.
Right.
And so Pippa has 2 of 3. So different parts of her upper airways kind of aren't a circle as such. They're not a column, a fixed column. They kind of come into an oval shape when she's swallowing and breathing.
So before, when you talked about that, did you say that was the contributing factor to the cerebral palsy because of that? Well, you don't know.
Well, it's a chicken and the egg, right? Was the floppy airway part of the problem that caused the brain to be starved of oxygen, or was it the other way around?
Yeah, okay.
And so that one, and also dysphagia, not to be confused with dysphasia, which is an S. Dysphagia is a delayed swallow. And that, again, may or may not be related to the cerebral palsy. Chicken and the egg, did it contribute or was it because of? And we think it probably came after because she was swallowing fine when she was a newborn. It was as we kind of went on that we saw things kind of go skew-iffy. And all of those impact her ability to function.
Yep. You know what you just reminded me of, talking about
hospital appointments and
the other kids, was years and years ago when I was a kid, I was part of the Crippled Children's Society, which I don't think exists anymore.
I actually think it does, but I don't think they call it
that. And they went on they had an Air New Zealand flight, and I got picked as a kid.
I heard about this.
Yeah, to go. And so basically we flew over the Cook Islands, I think, and came back. And as a person who was on the flight, which I can barely remember, but I do remember getting a massive bag of goodies and lollies, which my brother and sister totally swiped because they were massively jealous of this. You know, again,
I actually remember that flight.
Me getting all the attention.
Yeah.
And of course, being, you know, the kid that got on a plane, they had to wait at the airport, which would have been terribly boring. So they just took that bag and they just ate everything. So you can get stuffed. So
not that you're holding a grudge.
Yeah, no, not that any of us have ever forgotten it. They still lord it over me when we catch up that they did it.
Yeah.
And they were massively proud of it. So it's just one of those things that kids do to cope with the fact that one kid's getting all this attention, which they are just too young to realise that it's actually, you know, nobody would want it.
No.
But it's all just another thing. Kids all just
siblings
manage.
Particularly, I mean, I think they're just brutal to each other no matter what. I mean, these kids are so incredibly supportive.
Yeah.
When I'm not looking.
Yes.
When I'm not looking, they are just the most caring, and I say that jokingly, but semi-jokingly. I've seen Pippa not be able to pick her bag up. Or her bag doesn't come in from the car. And I have a rule that bags come in and bags get unpacked. There's, you know, it's quite a rigid routine. And she might be struggling one day.
Yeah, right.
And I've seen Phoebe not even question, not even like just instinctively go, oh, yeah, that's not going to happen.
Yeah.
I better get her bag up for her.
Over time, I mean, I have a 12-year-old son now. He instinctively does help with certain things if he thinks I need it or he wants me to hurry up. There's no chat about it or no emotion attached to it. He functionally just grabs it.
Yeah, and I love that support and that instinctive because it makes them more empathetic and caring humans as well.
Yeah, and that's important. I mean, because we did have my stepson living with us, but since he's left, I'm worried if we were raising this little psychopathic kid that actually just cared about himself, which I thought was massive.
And every child is kind of coming from that place.
So the fact that he helps dad out sometimes when he needs to means he's going to help other kids out, which sometimes I ask him, did you help anyone today? And he says no. Most days, nah, I just don't help other kids.
I have very similar conversations. My oldest, I'm like, so who are you? Like, who are you as a person? Because I'm not asking you directly that question, but I kind of really want to know. So far, so good. So far, the feedback has been pretty good. But
my encouragement to him is to be there when other people need you to be there.
Exactly.
Which I'm still not convinced he's quite got it yet, being an 11-year-old boy. But my hope is that, you know, from the fact that he has to help his dad out, who's got cerebral palsy, not that he cares, but
which is great as well.
But also just help when people need it.
Yeah, right.
So a common thing for cerebral palsy types was the foot with the heel raised up.
The tippy-toe walking, yes.
I actually remember, I can't remember that I did that. I must have. But I can remember another kid in the hospital who had a very high heel, so they just release it and it comes down. So I think they were pretty brutal operations for a little kid.
They are.
I do vaguely remember the cast on from the ankles to my hips.
How old were you when you had that one? You don't.
I think about 7 or 8.
7 or 8, yeah.
Yeah. And the hamstring release, I think, was quite a big operation.
I can imagine.
You know,
it's
where the
big.
cuts at the back of your legs, and I can remember the drain. Yeah. But thankfully, as a kid, you know what? All this, even the stuff that Pippa might go through before and after, they just don't really remember.
Yeah,
they kind of do, but they don't.
We've had a broken leg. We've had a spiral fracture of the tibia. All of which related to falls, trips and falls. So we've definitely had our share of aches and pains. We're very grateful. I always avoid the word lucky because no one's lucky or unlucky in this situation, but we're very grateful that with the form of cerebral palsy that she has and the level of it, that she I mean, she uses orthotics, and yes, she utilises her wheelchair, and we do see tippy-toe walking. We see all the classic signs. It's more, but she's more able to I call it masking. I don't know if that's the technical term, but that was also the curse of not getting a diagnosis, because she would show off to her specialists and be like, "Look, I can walk. I know what you're looking for, and I can show you how well I can walk." So as a toddler, and as she aged up, even when she was 4 and we got the diagnosis, she was able to mimic, and I use mimic very specifically, a normal gait.
Yep.
And so she's a very smart cookie, our Pippa. And so she would walk normally in front of the specialist, and they would go, "What are you talking about? This child's fine." Then she'd go home and she'd sleep for a week because she's so exhausted. It wasn't until we saw we went out to the Wilson Centre. It was sort of like a throwaway. We'll go and get. Oh, actually, her physio, who was sort of checking her over, noticed that she had abnormalities in her. Abnormalities in just the way her legs were, and certain movements were restricted and certain were hypermobile. And we went to see Dr. Jimmy Chong at the Wilson Centre, who was another Starship specialist referral that we got. And I always remember, and I think it was in the article, I always remember him sort of looking at me going, "So we're not here to work out if she does or doesn't, right? We're just working out the level of cerebral palsy that she has." And that stuck with me, because I was like, oh yeah. Okay.
Was that a bit of a shock when you heard that?
Yes, it was. It was, because up until that point, I'd been told, "Oh, it can't be that. It can't be that. It can't be that." But he was so amazed with how she was able to, like I say, mimic the natural gait for those short periods of time. When she didn't think he was watching, that's when she started to unmask. That's when she relaxed, and that's when her hand would twist and her leg would limp and her tiptoes came in. Because she can't maintain that. She can't maintain that for too long.
In the article that I read about you guys, I tell you the bit that resonated with me, because I remember doing this many times as a little boy. Watched her work down the hallway and sat down. When you have cerebral palsy, a little kid, you walk down a lot of hallways, and I remember being paraded in front of a room full of doctors with virtually nothing on, so they could see your hips and your...
Oh, that's... Yeah.
Yeah. But I just remember that's all part of the study of what you've got. I didn't see that as a bad thing, actually. I just thought that was just one of the... I wasn't traumatised, but I can just have a vague memory of it happening, just being paraded in a hall, in a room, like a stage. Yeah. And can you walk backwards and forwards? And that was like I didn't think it was... I just remember basically wearing... Not nothing, but so they could see my hips and how they were moving. Which I get, that's what you do when you study people with different types of gait.
We've been really lucky, and maybe it's not lucky, maybe it's education, maybe we're evolving as our medical system, and I'm sure it's all, everything changes so rapidly, but the respect for the child and the respect for and I use the term very loosely, patient, because Pippa's not a patient.
Yeah, right.
But it's there. And they're so amazing, almost to the point of I get frustrated, because I'm like, "You're not looking hard enough, or you're giving her too much slack, or, no, she needs to show you how she walks," or whatever it is at the time. Because they're like, "Well, let's hear what Pippa wants," or if Pippa doesn't want to dress a certain way, or, she'll wear leggings, and that's fine, that's enough. They don't expect her to get changed to show them. And I think all of that is such a great evolution of respect for the person that they are dealing with, the people that they're working with, the children, giving them back their autonomy. Because when you are somebody, especially a child, who is a part of that medical system in whatever way, because Pippa's not sick, Pippa just happens to have cerebral palsy, you're still a part of that medical system, significant part of that medical system. I mean, I think we lost count at about 12 specialists within the Starship community that she's engaged with or engaging with.
And that whole thing is exhausting for a start, because everything else you have to do in life, you got to fit this in as well. Yeah. So you're doing a great job. Look, I just keep thinking to tell you that she's going to be all right. Yeah. Because just meeting her for 10 seconds, I thought, this kid's going to be...
She's a pretty strong-willed child.
Also because you guys have got such a great family unit, that's important too, because if their emotional well-being was off, then you would find, I mean, this is just an observation of disabled people over the years that I've seen. Some of them look in terrible shape. It's usually because there's other things going on that we just don't know about. And often it starts with the parenting and the home they had. So if she's got a roof over her head, you guys are looking out for her, and she knows she can voice, she'll be sweet.
Thank you. It is something that, I mean, you never know. Somebody said to me once that you're doing a good job as a parent, or you're a good parent because you're worried that you're not. And it sort of stuck with me. Like, if you are thinking about how do I be a better parent, how can I better support my child, what can I learn, what can I do differently, then already you're on the way to being a good parent. Because
of course, because you're actually thinking about it.
Yeah.
But the other thing, of course, with every kid, that if your mum and dad are not okay as people, then that's just a common thing.
Oh, that's been a massive life lesson for me.
Yeah.
Actually, one of my biggest key points for any parent who has a child with any form of disability, or short-term or long-term, because, if you're dealing with the medical system and you've got, if there's a short-term medical event or anything like that you can fix in the future, or anything, is don't martyr yourself.
Yeah.
And I think that's a lesson I had to learn the hard way. Don't take it all on yourself. You might feel alone. You might feel like it's just you dealing with this mountain and feeling overwhelmed. Reach out to people, find that community, talk to if you're not getting it from your family, or your family aren't available, then find the people in that community to be with, because they get it.
When I came up with the idea for this podcast with Nathan, one of the two things that I thought of immediately was, one, a medical perspective of this cerebral palsy thing, because I wanted to know where it came from.
Yeah.
The reality is it's a mystery.
Nobody knows. Yeah.
It's a bit of a mystery. And two, parents. That as a parent myself, I also wanted to talk to other parents, just to help other parents who are dealing with it, because I don't think my parents had any support. I don't think there was anything, and because of the nature of what they were, they just got on with things, which actually ended up being, we didn't have too much tough love. But in reality, as a kid with cerebral palsy, you just grew into a teenager, then an adult, and you just cope with it because you already did. So it's actually all fine. But as a result of doing this podcast, one thing, if I was going to sit in front of a parent, the one thing I was going to say to them is that if they're doing a great job, tell them. And two, it's going to be okay. You definitely don't need to be too hard on yourself.
Thank you.
Because I've met your kids. They are sweet. And they are just normal, all girls. God, I've got boys. So, you've got a much more emotionally complex. Can I ask about, in terms of treatment? I wrote down, in terms of treatment, what has been suggested.
Oh, that's a really good question.
Because if you read up on the internet about cerebral palsy, there's some really interesting treatments. I think I saw marijuana at one point.
I've heard that.
Botox.
Yes, definitely.
For the muscles or something like that.
Yes, that's right. Yep.
I haven't quite
I've
seen
heard of those. Yes.
Yeah, haven't quite seen stem cell research.
I am very grateful that we have not needed to investigate those treatments yet. And I say yet because with cerebral palsy, one thing I've learned is anything can, like things, as we hit certain milestones, developmental milestones, things flare up or flare down. We are on quite a significant suite of medications, because one of the things with Pippa's cerebral palsy is it affects her nerves. And that's something that we were not expecting and did not know to look for. So Pippa has, and you may have noticed her hair's not brushed today, and she's got this beautiful, big, thick, curly.
As a guy, I didn't.
You didn't notice? Okay, well, it's in a ponytail. She has a bunch of nerves on the back of her head, and a bunch of nerves in her stomach that flare, and so she very eloquently and drew. She drew a picture for her specialist of what that looked like, and it was a lightning bolt, and we thought that was quite powerful because that's as a parent, or as anybody who doesn't have that experience of that pain, we didn't know. And so I just thought, she's got a bit of a sore head, or she's fussy with her hair being brushed, or whatever it was. No, she's just describing this lightning bolt of pain just on the back of her head on a good day. When someone tries to brush her hair, you can imagine how that level of pain would increase. And so we actually have gone down that path of medication, a nerve medication that's been life-changing for her in so many ways because we can hug her, or she can eat because she stopped eating because of the nerve pain in her stomach, and she wasn't able to have her hair brushed because the nerve pain in her head. And so these things that you think, oh, she's just being sensitive, oh, she's just being this, or she's just being that. And actually there was a really valid reason why these things were happening. So from a treatment perspective, we have not required Botox, although that's possible in the future. We're not ruling that out if needed. We haven't needed to worry or consider the bigger treatments, certainly not stem cell. She does, and like...
Yeah, I was joking when I said that.
I know, but look, I would never rule out anything in the future if it's to help a child or help my child, right? I'm also really wary of, I'm not trying to fix what isn't broken.
Yeah.
I think cerebral palsy particularly, it's just, she has cerebral palsy. It doesn't necessarily need to be fixed unless it's negatively impacting her life.
Yeah, understand. Wow, those side effects are just so fascinating. Do you think that any of these things that are happening could actually just might grow out of? Or do you think they're just one of those backwards and forwards type things?
That's a deep...
Hard to know, isn't it?
It is, but I've also learned not to look to that because I start wishing.
Yeah, right.
And one of the things, and that's actually... you've triggered me. I got to stop. Okay, so what you just said is something that medical people and parents and well-meaning individuals and family members have been saying to me since we started to discover these things about Pippa. And as a parent, I'm going to ask that people stop asking me that because it's really hard to say, no, she's not going to grow out of it. This is her life and it's okay. I don't need her to grow out of it. The nerve pain, absolutely. It would be wonderful if she did. But she probably won't, and that's okay. We'll find ways to work with that. But it's a really challenging thing when people say, do you hope she'll grow out of that? Or do you think she'll grow out of that? Or is that something she will grow out of?
Oh, so people actually genuinely say that?
All the time.
Yeah. Oh.
It's a bit on par with that one where I told you about before where people say, gosh, I don't know how you do it. I could never do it.
Yeah, right.
Oh, I'm so pleased that my child was normal. I don't, and it's like, far out, dude. But people they're well-meaning. They don't realise the impact because they're not in their situation, right?
I can tell you that somebody with an obvious disability, that the comparable statements that people say to you are, you're doing great. Or talk to you like you're 5. How are you?
Oh, yeah.
Like, as an adult, it's like, okay, then I'm good.
It was just side-eyeing you as well.
Yeah.
Like you spoke to her as if she was a baby. She just side-eye you.
I know.
Like,
they give you that eyes like, okay, dickhead. Yeah. Yeah. Okay. Yeah, I didn't mean to upset you.
No. And it's actually really, I'm pleased that you did ask that because it's a really important, I didn't realise how important it was to me to make that comment.
I'm going to ask you about somebody because I have been emailing him. So on this podcast, one thing I did want to talk about, and he emailed me back this morning to say, yes, let's catch up very soon, is Dr. Jimmy Chong.
Oh, brilliant.
So you made a recommendation to me, and as I said at the beginning of this podcast, one of the people that I wanted to talk to was the medical profession, get a clinical perspective of this cerebral palsy thing, and you'll appreciate the response I got because I told him that, because I thought being a doctor and being a specific, someone who studied things specifically for years and years and years, that he would want a clinical reason why to do it and what I was going to cover. Like I thought he was going to ask every question in the world, so I gave him quite a detailed response and what I wanted to talk to him about and why, and he said to me, there's a lot of things you want to cover here. He said, I'm quite chatty. And it's like, oh, God, I could be here for an hour because I said, okay, so what are the causes? Are there any cures? What's treatment do you recommend? All the stuff, because I know he runs a particular rehab medical place for kids. And And so I thought, okay, he's got a very modern approach to cerebral palsy and how he views parents and kids, and you raved about him.
I think he's just, we are very lucky with our medical team. Very lucky, and Dr. Jimmy is an absolute star in my eyes. He sees what Pippa can achieve, and he is one of her biggest supporters.
In what way?
Oh my goodness, he pushes her. He's helped us to push and find ways for Pippa to push herself physically and enjoyably, but also taught us how to manage her fatigue and has just absolutely championed her. I mean, he's. Sorry.
It's okay.
Anyway, he was one of the first people to sort of say, "Wow, Pippa, she's amazing, right? Like, look at how well she can mask. Look at how well she does this. I mean, she doesn't need to, but look how physically strong she is." And that was so really nice to hear, because we'd always been told, "Oh, she's got a weak side, or she's doing this, or she's doing." Oh yeah, the physio would be like, "Oh, we need to work on," and not that any of it was a problem, but it was a problem to solve or a problem to work out or whatever it was. But he really saw the potential, and so he got us involved in. He just championed this. He got us involved with functional adaptive movement, and sort of said, you need to go and see these guys. But they taught Pippa how to use her body, and they were like, it's kind of like gymnastics and athletics and everything combined. And so he was finding those things and like actively going, instead of saying, as a specialist, here's a piece of paper with some recommendations on it, or not even giving that, just like, "Oh, she's XYZ, see you later, I'll see you in a year's time." He sat there and got the email address. He gave me the details of this amazing physio that we're working with, who's ex-Wilson Centre and has just been incredible. And she's coming into our house and doing reformer Pilates. And she... He really passionate believes in these kids. But Dr. Jimmy, we might only see him annually, but when we get the quality of that interaction, sky high.
Well, obviously he's just got a great way with him to be able to push her physically, and she does it. Yeah. That's the other thing.
Well, she does it for him too.
Yeah, that's right. Yeah, does it for him, but not necessarily for you every single time or whatever. Yeah. So that says a lot about him. So, just to say the fact that he was chatty as a doctor, I mean, those two things didn't work together in my mind. Because the doctors that I used to see at Middlemore Hospital were the guys with the white coats and the half glasses that looked over top of you and told you that, that young man and all that sort of stuff. That's the era of doctoring that I used to have as a kid, which is fine because that's what they did. And I wondered at the time, when I look back now, for me, whether I didn't wonder why I didn't wear calipers, because that was the cerebral palsy thing of the day.
Yeah. Well, there's still the equivalent, right? I mean, you've got orthotics, but then the next level up's the splints. So, I never wore them.
Yeah. So I wonder.
Surprised.
Me too. I wonder whether that would have helped as a kid, because as I say, as an adult, you just get all the discomforts you get over.
If there's one thing that and I don't think it's necessarily, I'm sure it's improved since, you were a child, but I still see it on a regular basis, particularly as being part of the medical system for both my oldest daughter and for Pippa, is that information doesn't necessarily get communicated well. The supports, physical or the other supports that might be available, or the next steps, or, we didn't know that early intervention from a physio was really important. Nobody really said anything, and then, or an OT. Apparently we should have had an OT, but nobody kind of pointed us in that direction. There was no advocate. I'm sure there might be advocacy services out there, but in the hospital system, they just go, "Oh, you've got XYZ," and then that's it.
Yeah.
Mostly, which I think why Dr. Jimmy is such a breath of fresh air in that way, because he's looking at potential. And so one of the things that gets me really emotional is that I remember him turning around and going, "This girl is an athlete. Like, my goodness, she can make the Paralympics. Like, I see so much potential here." And I was like, "Oh."
Well, I mean, so far in recording this podcast, I've talked to 2 para-athletes.
I love that.
And one of them, he said that primary school was okay, but he said he was bullied in high school. And now
That's what I'm afraid of.
he's going to go on to, I thought he was brilliant. And Kurt is a triathlete.
I can't recall who it was, but there was a Paralympian, and I feel like I'm not sure if it was Kurt or not, who was at the Weet-Bix Kids Triathlon.
Don't know.
I can't recall. I'll have to look it up separately. But Pippa did it last year. She did the splash.
How did she go?
Oh,
She'd completed it, right?
not only did this kid complete it, my sister, who was her buddy,
No.
my sister, who was her buddy, got left behind in some ways, because she was so excited. So the splash, luckily, wasn't really swimming. It was at Point England Reserve, I think, from memory. So it was very shallow. So she sort of waded through it while she was watched, and then there wasn't the bike ride component because of the age. And so then she did the run, and the run was brutal. I mean, I won't even pretend that otherwise. She went they let her go in the very front of the pack.
It's about 1.5 k or something like that.
Yeah, furthest she's ever run
right?
in her way. And she didn't run the whole way, but she made it. And we had to laugh because so many times. I mean, the way the field was set up, it was backwards and forwards, effectively up and down the single area of field. They'd just done the rope so that you were literally going one end of the field to the other, to the other, to the other. So it was quite exhausting, but also you think you're halfway and then you realise you've still got to go there and back about 3 times. So she kept every time she crossed paths with me, she'd look at me and she's like, I can't do this. I can't do this. And I'd be like, you're doing it. You're not coming out of there. You're in the maze now. You're not leaving. So I'm the mean mum yelling at my child, no, you're not. No, you're not. Keep going. You're almost there. And all these other parents are going, go little Jimmy or go little Joe. And I'm going, keep moving, because it's what she needed at the time. But to bring it back to this, the only thing that really broke me is she sprints to the end, and there was this Paralympian, I can't recall his name, sorry, but he held up the medal. There was about three athletes, three or four, people who were, I can't remember if they were rugby players or sports people and some athletics people. Gosh, it's terrible. I can't remember who they were, but I remember he had the medal. I guess it's an emotional podcast, sorry. And she went running up to him because she was like, someone like me.
Yeah.
And then as soon as she sprinted across the line, got her medal. And he wouldn't even have known. He wouldn't even have known that because she was just the adrenaline of going across that line towards him. Sorry. Anyway, it was a really powerful, positive moment. And then even better is she then felt comfortable going, I need my wheelchair, because we had a wheelchair with us because we'd wheeled her there. She'd been amazing, and then instantly just collapsed. She was off school, I think, or she was in bed rest for about 3 days after that. I mean, when I don't want to sugarcoat it, when she does stuff like this, there is a massive impact on her. On her, we have to plan around that. But she felt comfortable getting into her wheelchair. She didn't feel different. She didn't feel like she had to try and force herself to walk to the car or anything. She was happy in her wheelchair because there was someone like her.
Yeah. I'm telling you, because I took my stepson to that and he completed it begrudgingly, I might add. But I thought it was an amazing thing for kids. That's an amazing thing for kids, that triathlon. And I know the level of the first one. I know kind of what the lengths and everything. That would have been really tough for Pippa to do. But so well done for encouraging her to do it. And I bet she's got that medal somewhere.
And the T-shirt. She asked to do it. And that's just like Run Club. If Pippa asks to do something, we find a way to make it happen.
Yeah.
I mean, that's my job as her mum, right, is to go, okay, yeah, let's do it.
So Dr. Jimmy's right. She's amazing.
Yeah.
She's pushing herself like that.
She's adamant she's going to represent New Zealand. So whether it be football, because she's football mad, whether it be athletics, because she does enjoy her athletics and she's pretty good at it, we find a way.
All right, last question for you. Mm-hmm. There'll be other parents listening to this podcast who have a similar story to you, different, just the same. Just having someone in the family, even if it's an extended family member, whether it's a grandparent. Any advice to the parents listening? Dealing with a child or a family member with cerebral palsy?
Yeah, I touched on it before about when I said don't be a martyr, and I think that a part of that is just be easy on yourself as well. As parents, too often we can go down that rabbit hole of thinking, what can I do differently, or am I doing this all wrong? Or and I think listen to what your child is telling you, and go easy on yourself, because it's not going to be perfect. It's not going to be, you don't have that cookie cutter family that you maybe expected you would have. It's not going to be, camping trips away every weekend or what it feels like everyone else has. But actually what you've got is probably a bit richer and a bit more meaningful in some ways, because you're taking the time. You have to take the time to get to know your child and what they need. And so appreciate those moments.
Yeah. Great advice.
Thank you.
Before I go, just want to tell you one more time, you're doing a great job with her.
Thank you very much.
She's a great kid, and she's going to blossom into a kid that's going to have her own life and be totally independent.
She's going to take over the world.
Yeah, absolutely. And if she wants to be a para-athlete, she will be. And, just meeting them, they all start with these humble beginnings and they just push.
Yeah.
And they do it. It's incredible. So let's keep in touch.
Definitely.
Okay. And
it's been fantastic meeting you.
Yeah, thank you very much for opening your heart to us. It's been amazing, and all the best to you.
Thank you, and to you. It's just been absolutely such a great experience. So thank you very much for having me.
Thank you for listening to the Cerebral Palsy podcast, and don't forget to rate and subscribe. Look out for us on Facebook and Insta. Give us some feedback at cerebralpalsypodcast@gmail.com, and don't forget Cerebral has 2 R's in it. We would also love to hear from you, your life, where you are, and of course the parts of this podcast that you connect with. All emails I will reply to personally, so please get in touch. I'd love to hear from you. Please keep living your best life with or without cerebral palsy. Another episode is coming soon.